correspondent in Uganda, Mike Arereng. Mike, a very good afternoon to you. Thank you so much for your time. So let's look at what's happening in Uganda first. The country has now completed that mandatory 42-day monitoring period after the last patient was discharged. How confident then is the government that, Ebola transmission have been fully contained, at least as far as Uganda is concerned?
Thank you very much, Unathi, and a very good afternoon to you. Well, as I speak right now, the situation Uganda happy giving that news from the Ministry of Health declaring officially that Uganda now is Ebola free. It will be remembered on July 16, 2026 was when the Uganda Ministry of Health discharged the last Ebola patient from the Mulago National Referral Isolation Center here in Kampala. And this marked the end of Ebola in Uganda. The outbreak caused by Bujubuju Ebola virus, a rare and less studied relative of the Zaire strain behind West African devastating. And 17 people so far were confirmed dead since the Ebola virus was here in the country since May 2026.
Mike, the line is a bit choppy, but let's see if we can proceed. I mean, when you consider that what's happening in the DRC, we know as reported cases so far stand, 3,200 cases rising there, and at least 1,405 deaths recorded. Give us a sense in terms of how Uganda managed to strengthen the surveillance, as well as the contact tracing, and importantly, community engagement to prevent a resurgence of the virus. What are health authorities telling you?
First of all, I would like to inform you that the Ministry of Health made sure that it sent the health officials, more especially at the border entry points between Uganda and Democratic Republic of Congo. As I speak right now, there is total border control. And remember, Uganda closed its border with Democratic Republic of Congo since May, and it has actually managed to control the situation. But it is still, you cannot control human beings because most of them, they don't use the official routes entering Uganda. Some of them use other routes to enter Uganda, and there's that fear that the Ebola virus still can enter the country. But so far, I can say because of the health alert and Ugandans being educated through the media platform, it has actually enabled Uganda, which is coordinating with the WHO officials, to manage to control the epidemic.
I want to stay on that note, given just some of those concerns around, infections, possibilities, and the risks there. How is then, the country coordinating, particularly with health authorities in the DRC? Are there any engagements, not only with Uganda and DRC, but also possibly other neighboring countries?
Apart from DRC, also the health officials actually in Uganda are engaging with the neighboring countries like Kenya and South Sudan. Remember, there was Ebola in South Sudan once upon a time, and also there was also fear of the Ebola epidemic actually also spreading up to Kenya. But this has been contained, and the situation now is okay. And people are still being educated. The masses are being educated about the dangers of Ebola, more especially the school children, because when they resumed for the second term in school, all of them were told to follow the SOPs, and this has happened. So that fear is no longer there, because you cannot enter a school premises without washing your hands. And also, they check, first of all, your temperature to know whether you have high fever, and immediately they take you to hospital for a medical checkup.
All right, so Mike, let's leave it there for now. Thank you so much for that particular update. That is our correspondent directly from Uganda, Mike Arereng.
Thank you too.
This is the Chart Toppers on Channel Africa.
Let's welcome Bien.